So my name is Konstantinos Gerasimidis. I'm a professor of clinical nutrition at the University of Glasgow and dietitian by training. I have been involved the last 20 years in studies trying to understand the role of diet and its interaction with the gut microbiome in the etiology, management and prognosis of people with inflammatory bowel disease. My role in the miGut Health is as an external scientific advisory board member. Absolutely. So the miGut Health project is a very exciting research opportunity which will give us a lot of information to understand what in our diet can influence the disease progression, the disease development, and disease treatment. In the current work packages, we understand how certain dietary components interact with the gut microbiome and how this interaction can cause disease, but also how we can manipulate in the future these microbes with food in order to improve patients' disease outcomes. Yeah, there's a very simple question, and we hear this question every day in our clinical practice. Patients want to know what they should eat in their diet in order to get better or to avoid a future disease relapse. Likewise, the healthy relatives of people with IBD would like to know what they should avoid in their diet or what they should include in their diet in order to reduce the risk of them developing inflammatory bowel disease in the future. There are many, actually, and one of the most common misconceptions is that fiber can exacerbate the symptoms. There's a lot of interest about dairy products and whether dairy protein or cow's milk protein in specific can affect the disease activity in people with IBD. There's a lot of interest about gluten intake, and of course one of the work packages here in the miGut Health is trying to understand whether gluten is an important trigger of disease in people with inflammatory bowel disease and whether a gluten-free diet can be a treatment option for certain people with the condition. Yeah, so miGut Health is trying to bridge what we call bench with the bedside. So there's a lot of preclinical, there's a lot of basic science research taking part as part of this large consortium, and the team is hoping to identify certain microbial signals and certain dietary components which together can cause disease. So in the future, the team is hoping to use these dietary components in the clinical practice through various types of dietary interventions which aim essentially to change the diet of people with the hope to manipulate the gut microbiome and in the end to improve patients' treatment outcomes. So the team has identified a few bacterial signals which may be associated with disease progression or disease development. I think in the future it would be quite nice to see whether we can actually manipulate these microbial signals, where this manipulation can be with food, with drugs, or with other microbial therapeutics. It would be quite nice to see whether manipulation of these microbial signals can actually improve disease outcomes in people who have the condition, but also can prevent the disease onset in those people who are at high risk of developing the disease. Okay, so yes, so basically what the team is trying to do here is trying to understand different research fields in the area of disease etiology, disease management, and disease prognosis. They use a multifaceted approach where they try to understand how certain microbes and dietary components can increase the risk of development in healthy relatives of people who do not have IBD, but they are related with people who've got the condition. They're also trying to identify how certain bacteria can increase risk of development, but they also have a few cohorts of patients who undergo various types of dietary therapies, and the concept here is to use these dietary therapies to manipulate the gut microbiome, ultimately improve the disease outcome of these people with the disease.